They moved it. Welcome to today's COVID-19 Echo hosted by USET. Emily, if you will go over some housekeeping tips with everybody.
Good morning, everybody. My name is Emily Field. I am the Senior Evaluation Specialist here. And as Brian just said, we're being recorded. This will be available by the end of the week on our YouTube channel. The recording will be shared, and so will presentations. If you are interested in claiming continuing education credits, we are offering continuing medical and continuing nursing. This qualifies as one unit, and in order to get the credits, you need to complete the survey just shared in the chat, and then also complete the hour. You have to be here for the whole hour, and then also complete the evaluation survey. If you're interested in just giving us feedback and don't want continuing education credits, please still follow this link. You can just skip it though and just go to next, and it'll bring you to the feedback page. And please feel free to ask questions throughout, and mute yourselves when you're not talking. That is all I have. Thank you. Oh, actually, please share your tribal nation, intertribal organization affiliation in the chat. We want to know what our reach is, and also it's just a good way to know who else is together today. Thank you.
Thank you, Emily. And just one additional note, that survey may say May 6th. Go ahead and select that date, even though it's not May 6th, it's May 13th. Yeah, it may be fixed by then, but it may not be. Okay, so we'll go ahead and get started. We have a full agenda today. We have Imani Ransby giving the Nashville area updates. We have Jennifer Downs, who is the behavioral health consultant with IHS Nashville area. She's going to give a presentation on mental health, and Anna Wood Miller, who is the new Tribal Health Program Support Director, will be giving a presentation as well. So you're in for a treat. Imani, if you want to go ahead and get started. Or pull up, yeah. Okay, great.
Thanks, Brian. So hi, everyone. Good morning or afternoon, and happy Friday. Thanks for joining us today. As mentioned, I will be giving an update on COVID-19 epidemiology for the Nashville service area or USET region. And so that will consist of taking a look at some of the graphs and figures that are currently featured in our COVID-19 USET area aggregate reports, which many may already be familiar with, but if not, please note that these reports do primarily focus on COVID-19 cases and vaccinations at this time. We are in the process of revamping or updating the COVID-19 surveillance reports and have also transitioned to a monthly schedule. And so we are anticipating to have the new monthly report ready to issue by Wednesday, June 1st. So from that point onward, we will be sending out tribe-specific and USET reports each first Wednesday of the month, unless you've already specified that you would like to remain weekly, which is the case with a couple of tribes. Just for your awareness, some of the information that we are looking to incorporate in the reports will include wastewater data, which we hope can be used as a warning sign for influxes in COVID-19 infection, and then coupling that with CDC COVID-19 community levels data, as well as COVID-19 hospitalizations and inpatient bed utilization. So we are working on those updates and look forward to sharing them come June 1st. That being said, we did go ahead and send out a round of reports last Wednesday, May 4th, mainly to provide everyone with a status update. So I will be going through some of that today. But as always, please note that the reports can be modified to better meet the needs of your tribal nation as you see fit. So please feel free to reach out to us, as we really want to ensure that these surveillance reports are structured in a way that is most beneficial to your tribe and addressing COVID-19 in your community as we all navigate this pandemic. So to start, I wanted to first take a look at COVID-19 testing data, and this is for the USET region or Nashville area in particular. So what we have listed here is the number of new positive test results, the cumulative total of positive test results, and then a 7-day positivity rate or percent positivity. Because I do not have data to refer to for this week specifically, we are looking at the numbers as of last Tuesday, May 3rd. And so at that time, we can see that we had a total of 72 for the number of positive COVID-19 tests at reporting facilities in the IHS Nashville area in the last week, and then 16,769 for the cumulative total of positive COVID-19 tests. And then the 7-day positivity rate was at 11.1%. So those were the numbers as of last Tuesday. I often like to compare the latest data to whenever we had an update last to just see where we were then versus now. And so when referencing some of the numbers reported from the previous month, specifically Tuesday, April 15th, the number of new positives was at 59, while the 7-day positivity rate was at 8.2%. So we have definitely seen increases in both of those data points, which also mirrors what we've been seeing in the US as a whole, kind of a steady rise in cases over time, maybe since around late March, April or so. Transitioning into this next graph and focusing a bit more on the positive tests over time, we have the number of new positive COVID-19 test results per week. This graph might look a little different from what you're used to seeing. Instead of a 12-week retrospective timeframe, we only have 6 weeks of data available to view right now. This is mainly because we did move to a monthly schedule for the USET report, and so we did not have a full 12 weeks of data. Despite not having that full 12-week timeframe, we can still see that as of lately, we have been on the rise as far as the amount of new cases we are seeing. Again, 72 new positives were reported as of last week. That is up from March and even February, according to this line graph. So it is possible that we could be maybe going into another wave, although we still aren't seeing record highs like we were February 8th to the 15th or the 15th to the 22nd, where we were at 139 and 109 new cases per week, or even when compared to the peak of 996 new positive tests, which is not listed here, but was we previously experienced. So like I mentioned with the other graph, we are also looking at 6 weeks worth of data here as well, and have the rate of new COVID-19 cases per 10,000 broken out by USET counties or purchase and referred care delivery areas, USET states, and the United States. Please note that the data featured on this slide is specifically obtained from CDC and state health departments, so it is not limited specifically to tribal citizens, whereas the information we reviewed on the past couple of slides was retrieved from the Indian Health Service, or IHS, so it is directly reflective of what's going on amongst USET membership. Even though this information is not limited to tribal citizens, we do feel that it's continued to be useful in assessing how the USET region is being impacted by the pandemic over time, as we can look at cases across 3 different levels, locally or at the county level, by USET states as a whole, and then nationally. So various states have not been reporting COVID-19 testing data regularly. So that may explain some of the fluctuations that are being seen with this graph specifically, as well as the omission of some of the data points due to lack of information to report on and moving to that monthly schedule, as I mentioned before. But the USET county or PERCTA rate for the week of April 26th to May 3rd was reported as 14.68 cases per 10,000, while the USET states rate was at 48.59 cases per 10,000, and then the US rate at 13.18 cases per 10,000. I also have the US rate available for the current week of May 3rd to the 10th, and that number was reported as 16.28 cases per 10,000, which is up from last week, that 13 cases per 10,000 numbers. So we can say that nationally, it does look like cases are on the rise. So I wanted to take the time to just quickly go over this visual from CDC. It is showing the COVID-19 community levels by county. As I mentioned at the beginning, this is something we're looking to include or adapt in the new surveillance reports. And in some, it shows you geographic areas with low, medium, and high levels in green, yellow, and orange respectively. And these levels are based on multiple parameters, including COVID-19 cases, new COVID-19 admissions, and the percentage of inpatient beds that are occupied by COVID-19 patients. So CDC has kind of come up with a way to use all of these to produce this map. And pretty much these different categories are meant to guide prevention measures. So if you are seeing low community levels in your area or the green, that would mean to make sure you're staying up to date with your COVID-19 vaccinations and to get tested if you are having symptoms. Whereas at the medium level, you would continue to do both of those things, in addition to also maybe talking to your healthcare provider or doctor about taking precautions if you are at high risk for severe illness. And then lastly, at the high level, you would want to continue everything that you would do at the low and medium levels, but also wear your mask indoors in public. But kind of getting back to the map itself, what really stands out here is the north and northeastern areas. They have been experiencing a lot of cases, and that definitely shows here as we see counties for Maine and New York primarily in orange and yellow. I will also say that I have been glancing at this map from time to time, and I've also noticed that for the rest of the country, we are also seeing some yellow poke through, whereas before most places were completely green. So again, I think that really supports what I've been saying as far as seeing some increases in COVID-19 nationally. But we can also look at the table to the right of the graph and see that still majority of the United States is in green, 81.6% to be exact, while 14.15% of the counties are in yellow and then 4.25% in orange. So moving on to COVID-19 vaccination data, a couple of things to note with the next few slides. Again, due to moving to a monthly schedule, the gold bar for reporting facilities in the Nashville area is actually reflecting data from March 22nd and then May 3rd, whereas the other two bars are showing data for May 3rd and May 10th. This will be the same case on the next couple of slides as well, so do please note that. I think many can agree that COVID-19 vaccinations and boosters have been a great resource in regard to the pandemic, as they have proven to prevent severe illness and death. So it is still important for us to continue encouraging those that are able to get vaccinated and boosted to do so. We are still making progress with getting people vaccinated in the United States, but it is noted that vaccine administration has slowed down a lot from when we first started. And with this bar graph, we can look at the percentage of population fully vaccinated by reporting facilities in the Nashville area, the United States, as well as the Indian Health Service. And then also, I did want to mention that for the bar for reporting facilities in the Nashville area does come from COVID-19 vaccination data that's sent over from IHS for a total of 17 sites conducting vaccinations. And so we do get that information from BAMS and the IHS COVID-19 dashboard data. And then the percentages for the other two bars are from CDC's COVID-19 data tracker. So as of May 3rd, the percentage of population fully vaccinated for reporting facilities in the IHS Nashville area or USET region was 53.1%. And then as of May 10th, for the United States, the percentage of population fully vaccinated was at 66.3%. And then for the Indian Health Service, it was 41.9%. So also do please note that the percentage for the Nashville area as a whole is expected to be higher than what we're seeing, as we do not have information from all of our membership. So we do expect that number to be higher. This next bar graph showcases data on the percentage of population fully vaccinated again, but instead here we have it broken down a bit more with all of the USET states, the United States, and reporting facilities in the IHS Nashville area. Again, with the bar in gold or yellow, the dates that correspond to the percentages are March 22nd and May 3rd, where as for the bars in gray, we are looking at data for the current and past week. So when taking a look at the percentages for the individual USET states, we do see that the percentages for this week range between 51.1% and 84.3%, with about 0 to 0.2% increases seen from the previous week for all states. The percent increase from week to week has remained relatively the same since I last presented on this information. Again, kind of showing us that vaccinations as a whole have slowed down since the rollout. I quickly wanted to go over this one last slide before closing, similar to the last two graphs, but here we have information for additional COVID-19 vaccination doses and booster doses. So essentially those that are fully vaccinated since they have been boosted, but also individuals that may have had an additional dose. Unfortunately, we cannot differentiate between the two at this time. But so like the last graph we saw, we have USET states, the United States, and reporting facilities in the Nashville area again displayed, except now we are looking at the percentage of population fully vaccinated that have received another dose of COVID-19 vaccine. And again, this does include booster and additional doses. So percentages for the individual USET states range between 26.5% and 62.7%, with about 0.1 to 0.2% increases seen from the previous week for all states. The percent increase from week to week for this graph has decreased from when I last presented this information. I think we were seeing 0.2 to 0.4% increases sometime in March. So it does appear booster doses may have slowed down. And it does look like the percent increases we are seeing for booster doses has pretty much remained the same. In summary, individuals are getting boosted, maybe not at a high level, but there is still progress being made there. Please feel free to reach out to our USET tech team if you have any questions or concerns related to COVID-19 or any other public health concerns that may be outside of that. We are always happy to assist with any technical assistance or questions that you might have. And our email address is usetepi@usetinc.org if you would like to get in contact with us. I will go ahead and take questions now. And then if not, I will pass it on to the next presenter.
Great presentation, Amani. Thanks for keeping us up to date. Up to date. It's still early, I guess. Do we have any questions for Amani at this time? You can feel free to save your questions to the end too. We can go ahead and move on. We have Jennifer Downs, the Nashville area behavioral health consultant with IHS, is going to give her presentation next. Taloa, if you can pull up her presentation.
Well, while that's happening, I can introduce myself a little bit too. So good morning or afternoon, everyone. My name is Jen Downs. I'm the behavioral health consultant for the Nashville area for IHS. I am a member of the Washoe tribe of Nevada and California. I live in Missouri and I telework full time for the area office. And I started a little over a year and a half ago with the Nashville area, worked for IHS headquarters prior to that. So my role is mostly administrative. I do provide some direct services via telehealth too in the Nashville area. So when the PowerPoint pops up, or I might just start talking even before it pops up, I'm gonna primarily be going over some statistics around COVID and how it's impacted us in the US as a whole, some information about how it's impacted us in Native communities and what we've seen there, and then a lot of stats on how it's impacted healthcare providers. And then I will wind down with some information on holistic responses to COVID, and then pass it on to Anua to take over after that point. So I don't see the PowerPoint yet, so I'm just going to go ahead and talk because it's not a big deal. Anyway, so I was going to just kind of point out, I pulled stats from some different places. Oh, there it is. Okay, holistic approach to mental health and resiliency. Great, thank you. So I'll pause here for just a second and just kind of talk about the medicine wheel you can see in the corner there. When we talk about a holistic approach, the way that would differentiate maybe from a Western perspective would be that we're looking, of course, at the whole person. So not just looking at a biomedical model, or not when we come into mental health, just solely looking at a psychological piece, but acknowledging that people as a whole have their spiritual, mental, physical, and emotional pieces of their life all interact with each other. And as Native people, even more so, that we would acknowledge that culture and social aspects and environment, the land, that all of that can and should be brought into aspects of healing and wellness. So we can go on to the next slide. So this is a piece that I pulled just talking about, I wanted to spend a little bit of time talking about early on during COVID, some of the stats that we were seeing related to mental health. The CDC published a report, and they acknowledged that there might have been some limitations in that piece, but early on, by June of 2020, they were seeing symptoms of anxiety disorder at 3 times the reports of the prior year. Depressive disorder was about 4 times higher than the prior year. Approximately 1 in 10 were reporting that they either started or increased their use of substances because of COVID-19. And suicidal ideation was also elevated. We can go to the next slide. A little further out, Boston College has done some research, and so we can pull out to like November of 2020, found that reports of anxiety increased to 50% and depression to 44% by November. And that was about 6 times higher than the prior year. And in adults age 18 to 29, the impact of mental health was more severe, seeing anxiety and depression increase to about 60%. So also there was just an overall report of increases in prescription medication related to mental health and counseling services, and in the recognition that there was just an unmet need for mental health services. Next slide. So talking about the impact on Native communities, we don't have as much stats, of course, like we always don't have as much stats when it comes to Native communities, but we know that we saw that and continue to see that Native communities were disproportionately impacted. That we should also acknowledge that psychosocial stressors were increased, and that exacerbates health inequities. So that's impacting physical health, such as diabetes, heart disease, asthma, obesity, all of those pieces. And then not in all of our homes, but in some of our Native homes, there's multi-generational homes with large families, making it difficult for social distancing. We know across the US that we have limited access to healthcare in Native communities. So all those pieces can increase the impact that COVID has on our communities. And just on a personal note, as the behavioral health consultant, I've spent some time talking with different behavioral health providers in our different tribes in our area. And then in my personal experience, I just kind of wanted to share some information too. But I have seen specifically in my personal counseling, more of an increase in anxiety, whether that's related to exposure, illness, challenges with jobs and finances, not being able to go out. But people in general, what I've seen is that they can't access the coping mechanisms they were using prior to COVID, although that's shifting now, of course, with things opening up. But on a personal note, that's what I've seen the most of. But people have reported in the Nashville area seeing an increase in anxiety, depression, substance use. Some, not most, but some have reported increases in domestic violence and child abuse. In general, organizations that work with domestic violence and child abuse were concerned throughout COVID when things were more shut down, that there were increases and yet people didn't have access to report or to get help. I had patients talk about that were just sitting and watching the news, so that caused an increase in anxiety and depression. And then we know in some of our communities in the Nashville area, specifically, that there was a hard hit and an increase in grief, and then not being able to grieve in the way that we would during COVID. And just in general, for everyone, acknowledging that there was an increase in stress due to COVID for all sorts of reasons. Next slide, please. This is just a quick picture pulled, and all I will say is like the darker pieces, so you can see specifically Mississippi, but some of the other states too are where Native communities were harder hit than their counterparts in Caucasian communities. So go to the next slide. So this is, I've shown y'all when I've presented it other times statistics. These are more recent stats related specifically to physicians and healthcare workers. But in 2021, 47% of physicians said they were burnt out. So that is, just so you have some background, this specific report was pulled from about 13,000 physicians in the US from 29 specialties. And most of them reported that the number one reason for their burnout was bureaucratic reasons. But there's a whole lot of other reasons too, and we'll get into those. There was also specifically for male and female genders, they went up from the prior year. 36% of men and 51% of women reported burnout that were physicians, and that went up to 41% for men and to 56% for women. But this stat was 42% in 2020, so it's up 5% overall for physicians in 2021. So that's the most recent information that we have. For emergency physicians specifically, you can see on that top line, if I'm remembering correctly, they weren't even in the top 3 last year, but they've increased. They were at 43% in the 2020 year of 2020, what they reported. And so they've gone up and are the number one reporting burnout now at 60%. I'm going to share just a little bit of information. They pulled some quotes from some of the physicians saying they have little motivation to reach out to others, that their patient has decreased, their patients, not patients they're serving, but their internal patients, has decreased, and that they feel irritable, that they're always tired, they have trouble concentrating, they don't have time for their children, they're fighting with their spouses. They just recognize that they're generally angry and unpleasant to be around, that there is some bitterness towards their spouses at times, even that they are ready to be done with their current occupation, but recognize that they are the breadwinners and that their income is needed, and so they feel kind of caught in the position that they're in. Go to the next slide. So just talking in general about all of us in healthcare, We tend to be people who are more at risk for burnout. We tend to be people who engage in self-care less. We at times have unhealthy eating, even though you'd think we'd be the opposite, minimize our social circles, isolate. We put others first and have that need to rescue. And so often we are more at risk than some others in the population for burnout. We can go to the next slide. So this is more stats from the same report by work setting. So the top two, or not the top two, but in the top three is where most of us would fit. Outpatient clinics at 58%, healthcare organizations and hospitals. So those are the work settings that are reporting the most burnout right now. And that's up for outpatient and hospitals specifically. Outpatient was 46% in the prior year. You can see it's up to 58%. Hospitals were at 40% in the prior year. They're up to 48%. You can go to the next slide. So I thought this was interesting too, whether there was more or less burnout than during our quarantine months now that we're shifting. And it's actually increased for people. And the report didn't have any specific information related to asking questions about why that was, but hypothesized kids are going back to school after quarantine. Others are returning to work. There's just a major life shift happening, and some people felt more safe being at home or having their families be at home. Also, during all of this, there's been a significant loss of staff in healthcare, and so trying to deal with all of that in the aftermath has put a significant burden on those that are still in the workplace. We can go to the next slide. So this is just some information on how physicians cope with burnout. The majority saying that they exercise at 48%, which is a good coping skill for burnout. The next one, not so much. Isolating from others can just create more mental health issues. You can see the next one is talking with family, good. Sleep, next one, good. Playing or listening to music, great. Then we see kind of a whole list of all of these others that are unhealthy: junk food, alcohol, binge eating, prescription drugs, and other substances. Okay, we can go to the next slide. So they were asked about their strategies for alleviating burnout. So the first one of thought stress reduction techniques is great. And then you can see some other mostly external pieces, but nothing wrong with that. The first one being internal, the others being external. You can go on. I wanted to acknowledge too that nurses are at the highest percentage rate, right up there in comparable burnout rates with physicians. Police not far behind them, and others, but just put in that piece specifically around nurses in healthcare. Next slide. So they were also specifically asked about depression. About a fifth of the physicians that participated in the research reported some type of depression. Of those that reported that, 24% acknowledged clinical depression, 64% said they were feeling down or blue. So a piece on that too, there's a difference between depression and burnout. Burnout is more of something where you're just at a feeling done place. Your occupational stress level is what's causing that. Depression, it has to do with your psychological, biological, social factors in your life, but they feed each other. One can put you more at risk for the other. Next slide. These are more just strategies and of what physicians have been using to maintain happiness or mental health, spending time with family, hobbies, again, exercise, all those same pieces up there, sleep and eating healthy. We can go to the next slide. So I wanted to take a a few minutes and talk about holistic health. Again, we kind of opened up with that piece. So going back to this is a quote pulled from the American Journal of Public Health talking about holistic care specifically for Native women. But I thought it was interesting too, just in prepping for this, looking at holistic healthcare and ideas around that. That terminology is interpreted widely and used in very different ways. So specifically, I wanted to pull some pieces that would apply to us as Native people. So this says the integrated model is an effective approach to working with Native women and understanding of Native traditions such as prayer, storytelling, ceremonies, along with an understanding of the importance of body, mind, and spirit are integral components of treatment. We can't separate ourselves into parts. We're part of a whole, and from a health perspective, we should be treated as a whole person. Let's go to the next slide. Johns Hopkins, just to give you a little background, has had a long time relationship with different tribal members of teams to do community-based if I can get the word out, participatory research. And so during COVID, they kind of shifted gears with these partners that they had and moved more to how they could actually be helpful during COVID. So this is a little piece of what they did. I'm gonna just kind of pull this piece out where they said the members, the tribally based team members kept going in their work even as operations were shutting down in schools. Caregiver roles were amplified, financial health and race-related stressors were peaking. So they're feeling all of these pieces, and that's kind of what caused this shift because they were recognizing that as Native people, there was a disconnect from culture, ceremony, and social gatherings. So they were trying to find a way to increase that piece, and we're looking for a more holistic way to approach COVID specifically. So we can go to the next slide. They sent out something called holistic wellness boxes, and I just was going to share some of the contents of what was in there. They put in sage, they put in cards, and the partners they have, a lot of them are Ojibwe, so that's where a lot of these pieces come from, that they were being culturally specific to the communities they were reaching out to. But they got permission from an elder and used the elder's teachings, and they were recorded and printed, and they were dealing with topics like stress and taking care of yourself and challenging emotions. They sent out ribbons that featured Ojibwe floral designs used for crafts or to practice mindfulness. And just a note on mindfulness, it has been shown to correlate with lower stress levels, better stress regulation, a decrease in suicidal thoughts. So tying in those pieces together. Lavender essential oil was sent out, and there are studies on lavender helping you to sleep. And sleep has huge correlation with all types of mental health, whether you want to go on the positive or the negative with how your sleep is, but it's related to depression, anxiety. It shows a correlation with suicide, a strong correlation with suicide, whether it's being alleviated or there's an increase in suicidal ideation, but positive sleep has a huge tie to it. They sent wild rice, which was significant for Ojibwe communities, recipes for traditional food, along with face masks, hand soap, sanitizer, and then also sent out specifically for the kids, Our Smallest Warriors, Our Strongest Medicine, which is a book for kids that was designed. It was modified from another book called My Hero Is You, How Kids Can Fight COVID-19, but it was made culturally appropriate, and you can still, if anybody's interested in that and you haven't seen that, you can go online and download that for free. So I put the link in there for that. We can go to the next slide. And I have shared this with you all when I've spoken in the past, so I won't go into too much of it, but I just wanted to acknowledge that Nashville area tribes were doing some great things during COVID. This is a picture of Mississippi Choctaw Clinic De-Stress Zone. So they put in there massage chairs, essential oils. They brought in plants for plant therapy, you can see on the table there that people could come in and color. On the door, I don't remember all the specifics, but there's information, I believe, about a former leader. And so it was just a place in their clinic where their staff could come in and get some relief. There were podcasts put out on grief, stress, mental health, which led into groups for those pieces. There have been monthly craft activities from different tribes, wellness baskets, similar to the wellness boxes we talked about, that were sent out to help, containing sleep masks, pedicure kits, weighted blankets, but acknowledging the whole person. We'll go to the next piece. I won't go into all these because I know we're running out of time and I want to make sure Anwa has enough time. But in there is just some tips for self-care that we've talked about in the past, but acknowledging that you are a whole person. So I just want to highlight a couple. The culture, community, and service engagement piece is specific to lifting. It will engage your mind. It will engage you socially. It impacts your emotions, and it gets you out and about and physical. So it's impacting you as a whole person and ties to us as Native people. And then sleep, physical exercise, and breathing exercises are some of the best things that you can do for yourself. But there's also several other tips in there for things you can do for self-care that acknowledge you're a whole person with body, mind, and spirit. Next slide. So I just always put these at the end of any presentation I do. If you do find that you have been persistently sad or anxious for weeks on end, and what you're doing is not helping, please do reach out to a spiritual leader, a mental health professional, your doctor, somebody that can get you connected for some additional support in your life. And then there's also some a crisis phone line for the National Suicide Prevention Lifeline, or a text line where you can text Native to 741-741. And I think if you go to the next slide, that's just my contact information. Thank you all for allowing me to present and to chat with you today. It's been an honor, and I will pass it on now.
Right. Afternoon. Thank you for that. Sounds, I really enjoyed it. A lot of what I'm going to talk about or had planned on talking about, you did cover, because these are some of the key components of looking at that health approach. So I am Anya Miller. I am a certified health coach, certified trauma recovery coach, and a change specialist. As Brian said, and the new USET THPS director. So my role changed since accepting this echo. So I'm just going to probably reiterate some of the things that Jen shared, and then look at more so of the emotional impact on where it shows up in the body. I want to spend a little bit more time with that, and I'll be mindful of time as well. Some of the objectives, as were covered, is identifying implications of COVID-19 examples, define the holistic approach, identify components of holistic approach, illustrate where challenges appear in the body, discuss the importance of immigration, and highlight, because Jen did a great job of already touching base on some of the additional implications of COVID, the availability of mental health professionals. As we saw, there was a shortage, there was a great demand, there was a revealing of personal support system status. Who is there for me? Can I answer this question? Many of us have not faced some of the challenges that COVID-19 presented. And when we look around, we see and define a strong support network around us to help undergird us through these challenging times. Again, access to mental health support and the evolution of telehealth in the mental health space that is some the comfort level, the access level, especially in Indian country, do we have that technology in place as well, coupled with the historical presence of health disparities that was revealed, and the implications of COVID-19 as well on household and social system dynamics. It impacted a lot, not only with domestic violence front, but just learning how to get along with each other in a small space if you're quarantined or being without that support, even the losses that we incurred, how our household and social system dynamics changed. There were financial disruptions that happened, complex PTSD, where you may have PTSD, post-traumatic stress disorder, but in having reoccurrence of a stressful and traumatic event, how that then turns into complex PTSD. Some of those things we well. Again, the stress, loss, and grief. Now I'll just really highlight plays over these because they were discussed already. What the holistic approach is defined as. A holistic approach means to provide support that looks at the whole person, not just the support should also consider the physical, emotional, spiritual well-being. Again, looking at the medicine wheel, we often refer to, and also Samson's model of epidemiology. We're looking at the emotional, the financial, the social, spiritual, occupational, physical, intellectual, environmental dimensions of wellness. All of those, and I like this depiction of it because we can see how they all function together and interconnect. And COVID affected every one of these dimensions, and warped or shifted their interaction and causing gaps in them as well. So why is this important to consider? Again, all dimensions of a person's life function together. So when we are dealing with our membership, when we're dealing with ourselves, when we're dealing with patients, we want to have that compassion, seeing how these all have all be tangibly physical. It may not always be valuation assessments that we can reflect what someone is feeling and able to put into words. So we're better able to meet the needs from a holistic perspective in our treatment and our approach and our interactions with our staff as well. The communication styles and the language that being mindful of that, having trauma-informed language, rather than saying somebody was triggered by this, maybe saying something nervous system was activated by a certain interaction or a certain experience, and understanding that saying it's all in your head, maybe because we are mentally processing all of the information and the external stimuli are hitting our bodies and our nervous system and imprinting on those. And technically, yes, our brain is integrating this information and this imprinting on our nervous system also then activates inflammatory responses in our body, or pain in our body that cannot lab test clinically be identified. Understanding this holistic approach and how external stimuli again impacts our body and our body system's responses is extremely important to understand the mechanism of stress and what happens in our bodies according to that. And as well, again, taking in Indian country historical impact, well, trauma, the generational trauma, the historical trauma that's happened, and now coupling it with present day trauma, this global pandemic, and how all of those things snowball. Understanding again how all of these input on our nervous system express itself. Just a second to show image of how that looks in the body. Again, understanding how the nervous system is responding to the additional stressors, helping citizens and staff to identify their best hope. Coupled with that, acknowledging the autonomy of decision access to resources. We may throw out a lot of different mechanisms, but it may not work best for that person. So being able to honor their autonomy, knowing that they are expert of their life, and recognizing what type of access to resources knowledge they have in order to carry out some of those. This is what I really wanted to get to, at the emotions of the body. So as we are talking with our citizens, talking from a client perspective, and even our own self, and we do the self-evaluation and looking how emotions show up in the body. This is, I think, a great depiction of understanding where those emotions show up. If there's pain in the knees, if there's pain in the hips, it could be tied to an emotional response. I'll just leave that up for a second, and then I'm going to show a video as well. What to look at. Couple of seconds. That, how they show up.
Hi, Anwa.
Yes.
Your audio keeps going in and out.
Okay, thank you for letting me know. Is that better?
Yes.
Come closer. Okay. So, looking at this map, you want to look at how maybe going from head to toe, where it shows up, how it shows up. And when you look at emotions, there's a lot of emotions tied to this. And looking at it from a holistic approach, these are some of the things that we may want to consider in understanding, and this is a whole nother presentation, but understanding how ACEs, adverse childhood experiences, also show up in the body and how it's linked to 75% of chronic disease. And so again, looking at ourselves, at life through a holistic approach will oftentimes reveal different answers and different approaches that we can also explore. So integration, talked about nourishing foods, proper sleep, setting boundaries. And this is a big one that oftentimes we feel like no is not a complete answer, but it absolutely is. And understanding the boundaries that we need, especially on the heels of COVID, and coming through that, we need our time to process, we need our time to balance, and we also need time to just step back from life sometimes a little bit so that we can breathe, setting boundaries so that we're not overwhelmed. And making those meaningful connections. Movement, not necessarily exercise, but movement and what's meaningful for that person. Hydration, of course, and education on balancing those other components. So looking at a holistic approach, if there is an imbalance and we need more information, more skills, more tools, more knowledge to help the function of that component, it is important to have that education and those balancing components as well. So this was brief overview. Again, just wanted to tag with Jen. So are there any questions and answers? And I just want to say thank you for chiming in. My information as well. So are there any questions?
Thank you, Anwa. Do we have any questions for Anwa or any of the other panelists today? And just a reminder to fill out the survey that is posted in the chat. Even if you're not going for the continuing education credits, it does give us feedback, helpful feedback for future COVID echo sessions. If there are no questions, we can go ahead and adjourn for today and see you next month. Thank you all.
Thank you. Have a great day.
Thank you. Thank you, Jen.
Thank you, Jen. Thank you, Amani and Anwa.